As it turns out, flossing is not just good for your teeth and your gum health, but it's also protecting your heart. There was a recent study published in Stroke, and they followed over 6,000 people for 23 years, and they found that people who flossed regularly had fewer strokes, and they also had less of a dangerous irregular heartbeat called atrial fibrillation. And the trend was dose dependent, meaning the more consistently people flossed, the lower their rates of stroke, including strokes caused by atrial fibrillation. Now, this was an observational study, so we can only infer a link. Maybe it wasn't the flossing. Maybe people that floss regularly also did other things that improved their heart health. But that link between oral health and cardiovascular health is pretty well established, and there may be a real mechanism underneath it. And a lot of it may come down to inflammation, but the same bacteria that cause dental issues may also end up doing damage far from your mouth inside the vessels of your heart. And the damage here lands two ways. So first, there's low-grade inflammation that can irritate the lining of your blood vessels, which then makes them more likely to build plaque and throw clots. And then we have studies where researchers looked inside some plaques, and they didn't just find cholesterol, they also found bacteria. A study published last year analyzed heart plaques from people who died suddenly, and in over 40% of these cases, they picked up DNA from bacteria called Strep viridans, which is also common bacteria behind dental plaque. And it wasn't just DNA that they found, they also saw bacteria themselves colonizing the plaque as a biofilm, the same film that built on your teeth, and that bacterial presence tracked with severe disease, and it tracked with death from heart attacks. And then there's the second mechanism. That constant inflammatory load seems to reach the heart's upper chambers and may make them more prone to atrial fibrillation, which is that common irregular heart rhythm where the top of the heart quivers instead of beating cleanly, and a heart that does that can form a blood clot that can travel to the brain and cause a stroke. And that inflammation may matter more than we thought. So cholesterol has been the heart risk number for years, and for a good reason, but inflammation, as we're finding out, is just as important. There was a collaborative analysis of 31,000 statin-treated patients where they pulled data from 3 major trials, and they found that their leftover inflammation, measured by a blood marker called high-sensitivity CRP, predicted heart attacks and strokes and death better than their leftover cholesterol did. So inflamed gums are one of the steady and fixable sources of that kind of inflammation, and flossing is one of the simplest daily ways to bring it down.